In over 95% of my rhinoplasties or nose jobs, general anesthesia is used. Now, what's general anesthesia? You know, we always hear about, is it twilight sleep? You know, is it, you know, what really is it? Or is there a breathing tube down my throat and there's a machine breathing for me? It depends. So there's different types. So one of the types that we'll use is called general endotracheal anesthesia. That's where a tube is put in between your vocal cords, you're fully asleep, and there's a machine breathing for you. Sometimes we'll use that. And again, with the proper anesthesiologist, you wake up and you're fine. You don't have any, you might have a little bit of a hangover the next day from the anesthesia, but overall, there's, maybe a little sore throat, you do fine. The other way to do general anesthesia is with something called a laryngeal mask. That's my preference. A laryngeal mask is a tube or a diaphragm which sits on top of your vocal cords and just blows air in. So there's no, intubation, there's no tube going between your vocal cords. And that's the way I prefer it, and that's general anesthesia. Another way is called TIVA, total intravenous anesthesia. You're sleeping, you have a little oxygen going through, and you're just completely asleep. I do that also. In 5% of my cases, local anesthesia is used, maybe a little Valium, and I give the patient some shots, little local anesthesia around the nose. Then it hurts a little bit, but the Valium makes it feel not as bad, and we'll do smaller procedures under local anesthesia. But again, that's about 5% of my procedures.